Have you ever wondered why something as small as the prostate can cause such big problems for millions of men? Difficulty urinating, waking up several times a night, or even facing a silent cancer that often shows nitrogen monoxide symptoms until it's too late. Today, we're breaking down exactly how the prostate works, why it grows as men age, and what really happens inside your body when a benign enlargement turns dangerous. And trust me, once you understand this tiny gland, you'll never ignore your urinary symptoms again. Hi everyone, welcome back to the channel. If you care about men's health, or you have a father, brother, or partner over 45, this video is a must-watch. Let's dive into the science, the symptoms, and the real treatment options. The prostate is a small gland in the male reproductive system. Its main job? To produce prostate fluid, one of the key components of semen that protects and transports sperm during ejaculation. But here's the interesting part. The urethra, the tube that carries urine from the bladder out of the body, passes right through the middle of the prostate. This means if the prostate changes even a little, it can directly affect the flow of urine. Inside the prostate, there are three important zones: the transition zone, the central zone, and the peripheral zone. Each plays a different role, and each is affected by different diseases. Throughout a man's life, testosterone controls how the prostate grows. But the prostate doesn't use testosterone directly. Instead, cells inside the prostate convert testosterone into a more powerful hormone called DHT dihydrotestosterone. DHT binds to cells and tells them to divide, to grow, and to keep developing. As men get older, something surprising happens. Testosterone in the blood slowly decreases, estrogen slightly increases, and DHT begins to accumulate inside the prostate. This hormonal shift is the perfect recipe for prostate enlargement. Benign prostatic hyperplasia, or BPH, affects over 50% of men over age 50, and up to 80% of men over age 70. Here's what happens inside the body. The transition zone located right around the urethra starts to grow. Both glandular cells and stromal, or fibrous, tissue multiply, forming nodules that push inward. As the prostate expands, it squeezes the urethra like a clamp. That's when symptoms begin: a weak or interrupted urine stream, difficulty starting urination, frequent nighttime urination, feeling like the bladder never fully empties, urgency, or dribbling. BPH is not cancer. But because of where it grows, it can significantly disrupt a man's life. One of the most effective medications is a 5-alpha reductase inhibitor. This drug blocks the enzyme that turns testosterone into DHT. Without DHT, the prostate gradually shrinks, often reducing symptoms within a few months. Other treatments include alpha blockers, minimally invasive procedures, and in severe cases, surgery. Unlike BPH, prostate cancer usually starts in the peripheral zone, far from the urethra. This is why early prostate cancer rarely causes urinary problems, and why men often don't know they have it. Cancer begins when glandular cells mutate and divide uncontrollably. They form clusters of abnormal glands and eventually tumors. These tumors can distort the gland, disrupt surrounding tissue, and in larger stages, push against the urethra, causing urinary symptoms. But the most dangerous part? Cancer cells can break away and spread, a process called metastasis. They can travel to bones, lymph nodes, and other distant organs. This is why early detection is critical. Depending on the stage and risk level, treatments for prostate cancer can include radical prostatectomy, which is the removal of the entire prostate, radiation therapy, hormone therapy to reduce testosterone and slow cancer growth, chemotherapy, and targeted minimally invasive surgeries. With modern treatments, survival rates are high, especially when detected early. So what should men do? Get regular PSA screenings after age 50, or even earlier if there's a family history. Don't ignore urinary symptoms. Maintain a healthy weight, reduce processed foods, exercise regularly, and talk to your doctor at the first sign of changes. Early detection saves lives. If you found this video helpful, hit like so YouTube knows this topic matters. Subscribe for more science-based health breakdowns every week. And share this with someone who might need it, because prostate health affects every man sooner or later. Thanks for watching, and stay healthy.